617-830-4750 is the number. We are taking all questions. Who's next on the phone with me?
This is Connor.
Connor, where are you calling from?
I'm from State College, Pennsylvania, Penn State.
Very nice. All right, what's on your mind?
I actually tweeted you this question, but it was a little long, so I understand why you didn't answer it. But
okay.
Basically, what it was is that my roommate, who is the complete opposite of me, where I'm progressive, just like you, he is trying to say that through some sort of WikiLeaks email that Hillary Clinton is more to the left than what we really think on healthcare, and that she wants the Obamacare to fail in order to push a single-payer system or public option. And I was just trying to get your opinion on this, because I think this is complete nonsense, and he thinks for some reason that's legit. I don't know what really makes him think that, and I just think that ever since the 90s, we've known that she's not for single-payer.
Okay, so if I understand correctly, the idea is publicly Hillary Clinton says she is for strengthening Obamacare, but in reality, she does want single payer, but it would be sort of optically bad to say, I want to get rid of Obamacare. So really, she wants Obamacare to just fail, and then she can swoop in and say, hey, we tried it, it failed. How about single payer? Is that sort of your roommate's idea?
Yeah, that's what it seems to be. He even includes Obama in that as well, not even just Hillary, but that's why I think it's bad. But I was just thinking what you thought of that.
I mean, listen, big picture, it's rare that politicians and elected officials make plans that would require many years beyond their tenure to be resolved, right? Because they want credit for stuff. So in general, if what you're talking about sounds, somewhere like a 10 to 15 year project, institute Obamacare, let it run its course, fail, propose the single payer. So it's really forward. It requires a lot of forethought. And generally, just elected officials don't usually think that way. They think in terms of election cycles. So that's like the big picture thing. At the micro level, we've heard from Hillary Clinton from some of her speeches and where she presumably was speaking more candidly. And there's been nothing to suggest that she wants Obamacare to fail to put in single payer. I mean, I just don't think there's any evidence for that.
Yeah, exactly. And that, the way I was thinking of it, because he included Obama, so I was like, Obama is way more into his legacy than even Hillary Clinton, probably. So it's like, why would he want what he has his name on to fail? So I just thought that was crazy and wanted to see what you thought about it.
Yeah, so. Connor, I agree with your assessment. I think absent some specific evidence, which I haven't seen any, I wouldn't buy it. All right. Thank you so much for the call. Really appreciate it. Gamefly is sort of like Netflix for video games. They have over 8,000 new and classic games for Xbox One, Xbox 360, PS4, PS3, Wii, and a bunch of other platforms. And you can play as many games as you want for one monthly fee. And if you find some games you want to keep, you can buy them for a low used price. There's never any due dates or late fees. And our audience can get a free 30-day trial at gameflyoffer.com/TDPS. The games are shipped directly to you with return envelopes included. There's no contracts, and you can rent games through the mobile app. Get the free 30-day trial for the David Pakman Show audience and support our show by going to gameflyoffer.com/TDPS.